Hello everyone, this is Dr. Sloan and this PowerPoint will be a review over the lower extremity. This is the femur and you're looking at a posterior view. This is the head of the femur, neck, anatomical neck of the femur. This is greater trochanter, intertrochanteric crest, lesser trochanter. The gluteal tuberosity would be right here, and this is linea aspera. Moving to the distal end of the femur, these are your condyles. So this would be medial condyle because medial side is the same side as the head of the femur. So medial condyle, lateral condyle. Just above the condyles will be your epicondyles. So this would be lateral epicondyle and medial epicondyle. Okay, so this is a magnified view of the distal end of the femur. So here's medial condyle, medial epicondyle, intercondylar fossa, lateral condyle, lateral epicondyle. This is the patella, and this is an anterior view of the patella. This is a posterior view. This is the base of the patella, and here's the apex of the patella. Looking at the knee joint here, this is the distal end of the femur and proximal end of the tibia. So the tibia is the weight-bearing bone in the leg. See, the fibula is not attached here to the femur. So we've got lateral condyle of the femur articulates with a lateral condyle of the tibia. Medial condyle of the femur articulates with medial condyle of the tibia. Okay, so in between the condyles here are the meniscus. So on this side, this would be lateral meniscus and medial meniscus. Okay, also seen here are the cruciate ligaments. This is anterior cruciate ligament, and this attaches to the tibia anteriorly. And this is posterior cruciate ligament, okay, crossing behind it. So anterior cruciate ligament, posterior cruciate ligament. This is medial meniscus because we're on the medial side. Here's lateral meniscus. We can see we're on the lateral side because this has the fibula. This is fibular collateral ligament, also known as lateral collateral ligament, or LCL. And this is the tibial collateral ligament, which is also known as the MCL, or medial collateral ligament. On this view, what you're seeing is this is actually the quadriceps femoris coming down over the patella, and this is the patellar ligament and tendon attaching to the tibial tuberosity. So what's been done here, it's been cut and reflected inferiorly, so you can see now the femur and tibia. Okay, so first identify which side you're looking at. So this is opposite of the last photo because you can see the fibula here. So this is going to be the lateral side, and this is medial side. Okay, so this would be lateral condyle of the femur, lateral condyle of the tibia. So in between the two, this would be lateral meniscus. Okay, and you can see this ligament right here. And again, we're on the lateral side or fibular side, so this would be fibular collateral ligament or lateral collateral ligament. Okay, move over to the medial side. This would be medial condyle of the femur, medial condyle of the tibia, and this is medial meniscus, okay, between the two. Okay, this ligament over here on the medial side, this is medial collateral ligament, MCL or tibial collateral ligament. Okay, you can also see the anterior cruciate ligament, ACL, and then posterior to it you can see the posterior cruciate ligament, PCL. This is the tibia, which is the medial bone in the leg. So this would be the medial side because you can see the medial malleolus right here. So we know this has got to be the medial condyle. So this would be lateral condyle because it's opposite side of the medial malleolus. There's a little projection up here. This is called the intercondylar eminence, and there's a projection right here called the tibial tuberosity. Okay, this is where the patellar tendon and ligament attach. And this is looking at the tibia from a superior to inferior view. So this is the superior end of the tibia. So this is medial condyle, lateral condyle. You can see a little bit of that intercondylar eminence protruding up here. And you can see the tibial tuberosity projecting anteriorly. This is the fibula. This is the lateral bone in the leg. So this is the head of the fibula, and there's a projection up here called the apex of the head of the fibula. And then on the fibula, the lateral malleolus is the distal end. Looking at the foot from a superior view, these are the tarsal bones. There are 7 tarsal bones in the foot. Here are your metatarsals, 1 through 5, 1, 2, 3, 4, 5. Phalanges, and we have proximal, indicated by the pink proximal phalanges, middle phalanges, indicated by the purple color for 2 through 5 digits, and then distal phalanges, indicated by blue, okay, in 1, 2, 3, 4, 5. Okay, naming the tarsal bones, and we're looking from a superior view. The most superior tarsal bone is going to be the talus, right here. This is the calcaneus on the heel. The green is indicating the navicular bone. Okay, on the lateral side is the cuboid. And then you have 3 cuneiforms, and they are in order from lateral to medial or in their place. So here's lateral cuneiform, middle cuneiform, and then medial cuneiform. This is also a superior view of the foot, so we can see the most superior tarsal bone. This is the talus. Okay, down here is the calcaneus. On the lateral side, this is cuboid. This is navicular, medial cuneiform, middle cuneiform, lateral cuneiform. Okay, and these are your metatarsals, 1, 2, 3, 4, and 5. These muscles right here I'll call your dorsal interosseous muscles. We're looking at the dorsum of the foot. They're in between osseous bones. Okay, so dorsal interosseous muscles. And here are your phalanges. Again, 1, 2, 3, 4, 5. Proximal phalange, middle, tiny, 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 and distal phalanges. This is a medial view of the foot, so you can see the plantar arch right here, but this is the calcaneus. Okay, sitting up top is the talus bone. This is the navicular, medial cuneiform, and this is the metatarsal of the first digit, the hallux, proximal phalange, and distal phalange. What you see here is an anterior view of the right thigh. So the inguinal ligament would be right here. Distal to that is the femoral artery. Okay, and then you have the little branches given off in this area of the femoral triangle. Moving laterally would be the superficial circumflex iliac artery. This is superficial epigastric artery. And then this is the external pudendal artery. Okay, the femoral artery will give off those branches very proximal to the inguinal ligament. Moving laterally is the, and superiorly is the superficial circumflex iliac artery. Superomedially is the superficial epigastric artery. And then medial is going to the perineum is the superficial external pudendal artery. Okay, the femoral artery gives off a big branch called the deep artery of the thigh, which is also known as the deep femoral artery or profundus femoris artery. It gives off the medial femoral circumflex artery, which wraps back around to the head and neck of the femur, and the lateral femoral circumflex artery, which gives off an ascending, transverse, and descending branch. Okay, after the femoral artery comes down, it will pass through the adductor hiatus and then emerge posteriorly, where you'll see it in the popliteal fossa. Okay, at this point, it's changed names to popliteal artery. So this would be like we're looking at a posterior view. This is the continuation of the femoral artery after it passes through that adductor canal and is seen posteriorly. Okay, in the popliteal fossa, this is popliteal artery. There are 4 branches given off around the knee joint, and these are called genicular branches. They form an anastomosis around the knee joint, and they are named for their position. So we have the supromedial genicular artery, infromedial genicular artery, supralateral genicular artery, and inferolateral genicular artery. Okay, popliteal artery will branch into an anterior tibial artery and posterior tibial artery. Coming off the posterior tibial artery is the fibular artery. Okay, so these will continue down the posterior leg. The anterior tibial artery will continue down the anterior leg. The anterior tibial artery, once it crosses the ankle joint, will change names to dorsal pedis artery, and this is on the dorsum of the foot, which then continues around as the arcuate artery. Okay, posterior tibial artery will continue to the sole of the foot, where it will branch into a lateral and medial plantar artery. Okay, if we're to do a transverse cut through the thigh, so this would be like we cut the femur here in the thigh. You can divide the thigh into 3 main compartments: the anterior compartment, medial compartment, and posterior compartment. Okay, the anterior compartment is primarily innervated by femoral nerve, medial compartment by the obturator nerve, and posterior compartment by the sciatic nerve. Okay, the anterior compartment is primarily knee extensors, also some hip flexors. Medial compartment is mostly adductors, and posterior compartment is mostly knee flexors and hip extensors. Okay, so following the femoral nerve here, it comes from L2 to L4, comes down past the inguinal ligament. Okay, it can be seen in the femoral triangle, okay, which is bound by the sartorius muscle, adductor longus, and inguinal ligament. So femoral nerve, artery, and vein in order from lateral to medial in the femoral triangle. So femoral nerve comes down and immediately gives off these muscular branches. This is just moving further down that same image. And the femoral nerve giving off the muscular branches, there is one branch that continues down and does not penetrate a muscle. It's called the saphenous nerve. So this will continue on past the knee joint. It will follow the same pathway as the great saphenous vein. Okay, also from L2 to L4 nerve roots is the obturator nerve. So the femoral nerve was from L2 to L4. You saw it here in the pelvis, just lateral to the psoas major muscle and then coming down past the inguinal ligament. Okay, the obturator nerve comes from L2 to L4, will be seen medial to the psoas major, goes through the obturator foramen, and then continues down here and it branches into an anterior branch, which will be seen anterior to the adductor brevis muscle, and a posterior branch, which will be posterior to the adductor brevis muscle. Okay, so if you're looking at an anterior view from L2 to L4 nerve roots, forms the femoral nerve. It immediately branches into muscular branches. Also, the saphenous nerve is given off from the femoral nerve, and this will be seen with the great saphenous vein. This passes the knee joint on the medial side. Okay, and this is of course bilateral. Okay, from L2 to L4 is also the obturator nerve. It branches into an anterior and posterior branch. The anterior branch will be seen anterior to the adductor brevis muscle. The posterior branch will be seen posterior to the adductor brevis muscle. On this anterior view of the thigh, this is the inguinal ligament. Here's the sartorius muscle, okay, originating at the anterior superior iliac spine. This is the tensor fascia lata, connecting to the iliotibial tract. Okay, this is quadratus femoris. So this is the rectus femoris, vastus medialis, vastus lateralis. Okay, here are your adductors. So this is adductor longus that you're seeing right here, and you can see part of the gracilis. And this is femoral artery. On this image, the sartorius muscle has been reflected. So what you're seeing here, this is rectus femoris muscle. This is rotated just a little bit. So this is actually the vastus medialis, and this is vastus lateralis. Okay, here's tensor fascia lata and the iliotibial tract. Okay, you can see just a little bit of it here. Okay, this is the iliopsoas muscle, so we are distal to the inguinal ligament. So this is the conjoint tendon of the iliacus and the psoas major muscle. We'll insert on the lesser trochanter. This is the pectineus muscle. So these are innervated by a femoral nerve. And this is adductor longus, okay, adductor longus, and adductor brevis. Okay, and this is the gracilis muscle right here. So adductors are innervated by obturator nerve. Okay, on this anterior view, this is the inguinal ligament. This is actually the spermatocord right here. And this is the femoral artery. Okay, femoral artery continues and goes through the adductor hiatus, where it will then emerge posteriorly and be named the popliteal artery. Okay, you can see the superficial circumflex iliac artery given off superolaterally up here near the inguinal ligament. These are all branches from the femoral nerve. And what you're seeing here, this is the lateral femoral circumflex artery. So that comes off the deep artery of the thigh, or deep femoral artery. Okay, looking at a posterior view of the gluteal region, this is the iliac crest up here. This is the gluteus maximus muscle that's been removed, and it attaches to the iliotibial tract. Okay, deep to the gluteus medius, deep to the gluteus maximus is the gluteus medius muscle, and that has actually been removed on this image as well, so that you can see the gluteus minimus muscle. Okay, so here's gluteus minimus. This is piriformis. Okay, if you see a nerve exiting superior to the piriformis, it is the superior gluteal nerve. Okay, and this goes to your gluteus medius and gluteus minimus muscles. Okay, if there's an artery and a vein that's exiting superior to the piriformis, that's your superior gluteal artery and vein. It will follow along that same course as the superior gluteal nerve. Okay, if you see a nerve exiting inferior to the piriformis, okay, with small branches here, this is the inferior gluteal nerve, and this goes to the gluteus maximus muscle. Okay, this is the sciatic nerve. Okay, also seen on the posterior side, it'll be a small branch, will be the posterior femoral cutaneous nerve. There's some other small branches here going to the lateral hip rotators. So we've got the nerve to the obturator internus, nerve to the quadratus femoris. And what you're seeing here, this is obturator foramen. So this is obturator internus muscle. Superior to that would be the superior gemellus muscle. Inferior to that is the inferior gemellus muscle. Okay, and then this is the quadratus femoris muscle. Also seen here, this is sacrotuberous ligament, and this is sacrospinous ligament. Okay, so looking at a posterior view, you'll see the sciatic nerve most often exit just inferior to the piriformis muscle. If you see a nerve exiting superior to the piriformis muscle, that's the superior gluteal nerve. This goes to the gluteus medius and gluteus minimus. If you see a nerve exiting inferior to the piriformis muscle, that is the inferior gluteal nerve, and this goes to the gluteus maximus muscle. Okay, about the area of the popliteal region, usually a little bit proximal to it, maybe a third of the way or 2/3 of the way down the femur. The sciatic nerve will split into its two divisions, which are the tibial division or tibial nerve and the common fibular nerve. Okay, the common fibular nerve will branch into the deep fibular nerve, and this will move to the anterior leg, and it will be seen with the anterior tibial artery. The common fibular nerve also will branch into the superficial fibular nerve, which will innervate the lateral compartment of the leg. Okay, tibial nerve goes down the posterior leg. This will be seen with the posterior tibial artery. Will continue to the sole of the foot, where it branches into your medial and lateral plantar nerves. Okay, looking at this posterior view, this is a left posterior view. So this is the iliac crest right here. Okay, gluteus maximus has been removed. It looks like the gluteus medius has been removed. And what you want to do whenever you're looking at a posterior view of the gluteal region is find the piriformis muscle. Okay, so here's the piriformis muscle. Superior to that is either going to be gluteus minimus, okay, or gluteus medius. So see these veins and arteries and nerves that are exiting from superior to the piriformis. This is superior gluteal nerve, artery, and vein. Okay, down here, if you move inferior to the piriformis, these little branches right here, these are part of the inferior gluteal nerve, artery, and vein. Okay, large nerve right here, this is the sciatic nerve. These are your lateral hip rotators. Okay, so this is superior gemellus, obturator internus, inferior gemellus, and then here's quadratus femoris. Okay, so here's piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Also seen here, this is the ischial tuberosity. So with your hamstring muscles attaching. So ischial tuberosity here, this ligament going to the sacrum. This is the sacrotuberous ligament. Okay, so this is a right posterior view. So you can see the gluteus maximus has been removed, as has the gluteus medius. So what you're seeing here, this is gluteus minimus muscle. This is piriformis. Here's piriformis. And these are your lateral hip rotators. Okay, the piriformis is also a lateral hip rotator or external hip rotator. Okay, so superior gemelli, obturator internus, inferior gemelli, and then quadratus femoris. Okay, the sciatic nerve. And then also seen here, this is the sacrotuberous ligament. Posterior view, this is the gluteus maximus. Okay, gluteus maximus inserts on the iliotibial tract. What you're seeing up here, this is the gluteal aponeurosis covering the superior portion of the gluteus medius muscle. This image has the gluteus maximus cut and removed, as well as the gluteus medius muscle. So deep to that is the gluteus minimus muscle. Here's the piriformis. Okay, superior gemellus, obturator internus, inferior gemellus, and then quadratus femoris. Here's the ischial tuberosity. So this is sacrotuberous ligament. And what you're seeing here, this is sacrospinous ligament from the ischial spine to the sacrum. Attaching from the ischial tuberosity will be your hamstring muscles. Going medial will be the semitendinosus and semimembranosus. Lateral will be the biceps femoris long head. And you can see part of the adductor magnus from the posterior view. This cadaver image has the gluteus maximus cut and reflected. What you're seeing here, this is all gluteus medius, still with some of that gluteal aponeurosis attached here. This is the piriformis muscle. Okay, piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. Okay, this is ischial tuberosity, so this would be biceps femoris, the long head, and this would be semitendinosus. Deep to that would be semimembranosus. This image has the gluteus maximus cut and reflected. Remember that attaches down here to the iliotibial tract. This is the gluteus medius up here, and that's been cut. Here's the inferior portion of it, reflected inferiorly, and then deep to that, this is the gluteus minimus. Okay, so find the piriformis muscle right here, piriformis, and then exiting superior to the piriformis will be superior gluteal nerve, artery, and vein. And that's going up here to the glute min and glute med. Okay, inferior to the piriformis, if there's a nerve, artery, and vein coming down, this will be the inferior gluteal nerve, artery, or vein. This is the sciatic nerve, and posterior femoral cutaneous nerve. These are also your lateral rotators of the hip, so superior gemelli, obturator internus, inferior gemelli. So the sciatic nerve will be overlying those, and this is quadratus femoris. This is sacrotuberous ligament right here, attaching ischial tuberosity to the sacrum. So this would be hamstring muscles down here. Okay, moving further down into the posterior thigh, this is ischial tuberosity right here. So here's sacrotuberous ligament, and you're just seeing this has the gluteal muscles removed as well as the piriformis. So you can see superior gemelli here. This is inferior gemelli. This does not have the obturator internus on it. Here's quadratus femoris. Okay, so you're actually seeing greater trochanter of the femur right here. Okay, these are your hamstring muscles. So we've got medial hamstring and lateral hamstring. Okay, so attaching to the ischial tuberosity and moving medial, this would be the semitendinosus. Okay, semitendinosus, and then semimembranosus is deep to that, also attaching to the ischial tuberosity. Okay, and then moving laterally, this is biceps femoris. This is the long head of the biceps femoris. Short head of the biceps femoris is going to attach to the shaft of the femur. Okay, it will not originate off the ischial tuberosity. This is that same image just magnified. So again, here's sacrotuberous ligament. Here's sacrospinous ligament. So this would be your semitendinosus. Deep to that is semimembranosus. And this is long head of the biceps femoris. What you're seeing here is part of the adductor magnus. You can just see it from the posterior side as well. Okay, in this same image, just moving further distal, here's semitendinosus. Okay, so it's got the longer tendon on top, semitendinosus. Deep to it, and you can see on either side, this is semimembranosus. Okay, lateral side is, and we know this is lateral because here's the fibula, as the biceps femoris. This is the long head, and then the short head of the biceps femoris. Here's gluteus maximus, adductor magnus, the posterior or hamstring part of the adductor magnus. Continuing down, this is semitendinosus. So see the long tendon right here on top, semitendinosus going medial, and that overlies the semimembranosus. These both originate off the ischial tuberosity. Okay, going lateral will be the biceps femoris, the long head, and the short head of the biceps femoris originates off the femur. Okay, and also goes lateral. Okay, what you're seeing in here, this is the tibial nerve. Okay, the branch off the sciatic nerve, and this is common fibular nerve. This is the lateral head of the gastrocnemius and medial head of the gastrocnemius. This has the gluteus maximus reflected, and this is the piriformis muscle. Okay, so seen here, this is the gluteus medius. Here's sciatic nerve. Superior gemelli, obturator internus, inferior gemelli, quadratus femoris. Sacrotuberous ligament. Semitendinosus. Semimembranosus, you can see on either side. And this is biceps femoris going lateral. Okay, long head. This is tibial nerve, common fibular nerve, which will branch into superficial and deep fibular nerve. And here going superficial to the gastrocnemius muscle, this is lateral and medial head of the gastrocnemius. This is the sural nerve. Here's the popliteal fossa. So again, here's semitendinosus. Here's semimembranosus, deep to it. Biceps femoris, the long head. Okay, coming down from the sciatic nerve, you're going to have the tibial nerve in the popliteal fossa and common fibular nerve going laterally. Also seen here will be popliteal artery and popliteal vein. This is lateral head of the gastrocnemius muscle and medial head of the gastrocnemius muscle. And this is the sural nerve. Sural nerve. Okay, so looking at this image here, and to determine if you're looking at medial or lateral side, because you want to have that down so you can determine which hamstring muscle you're identifying. You can see this is the gluteus maximus right here. Okay, so gluteus maximus is going to come down and insert on the iliotibial tract right here. So we know this has to be the lateral side. So your lateral hamstring is going to be biceps femoris. So here's biceps femoris. This will be the long head of the biceps femoris. Okay, and then on the medial side, you're going to have semitendinosus. So you can see the tendon right here. Semitendinosus. Okay, and then deep to that, you can see on either side, semimembranosus. Okay, so semitendinosus and then semimembranosus. This is the popliteal region. Okay, so what you're seeing here, this is semitendinosus, semimembranosus. So this is popliteal fossa. Here's the sciatic nerve coming down, and sciatic nerve will branch into common fibular nerve and tibial nerve. Okay, so this is sciatic nerve branching into common fibular nerve and tibial nerve medially. Okay, so in the popliteal fossa, you'll see tibial nerve, popliteal artery, and popliteal vein. Okay, remember these will then branch into anterior and posterior tibial artery and vein, but in the popliteal region, they will be popliteal artery and popliteal vein. And this is tibial nerve. Here's the popliteal fossa, so popliteal region right here. This is lateral side. This is biceps femoris long head. We know this is lateral because here's the lateral malleolus of the fibula. We know this is medial side because here's medial malleolus of the tibia. Okay, so biceps femoris, here's long head, semitendinosus, semimembranosus, and then forming the infralateral and inframedial borders of the popliteal region is lateral head of the gastrocnemius and medial head of the gastrocnemius. Okay, this will come down and attach to the calcaneal tuberosity via a common tendon. This is the calcaneal tendon. Okay, along with the soleus, which is deep to the gastrocnemius. In this image, what you're seeing here, because the gastrocnemius is still attached here, this is actually the small saphenous vein, okay, because that will be superficial, and the sural nerve. Okay, so calcaneal tendon, gastrocnemius muscle. Here's biceps femoris. This is actually the long head, semitendinosus, and semimembranosus. Okay, if we are to move further down into the leg and do a transverse cut, you'll cut through the fibula and the tibia. So tibia is medial, fibula is lateral. You can divide this into three main compartments: the anterior compartment, lateral compartment, and posterior compartment. Okay, the anterior compartment is going to be innervated by the deep fibular nerve. The arterial supply will be via the anterior tibular artery. The lateral compartment will be innervated by the superficial fibular nerve, and posterior compartment will be innervated by the tibial nerve. Okay, arterial supply will be the posterior tibial artery. Okay, lateral compartment, arterial supply, fibular artery. Okay, most of the anterior compartment are going to be extensors. So these are going to be muscles that dorsiflex the foot at the ankle, or dorsiflex the ankle, also extend the toes and invert the foot. So this would be like the tibialis anterior, extensor hallucis longus muscle, extensor digitorum longus. So that's the anterior compartment of the leg. Okay, lateral compartment of the leg will be the everters of the foot, so your fibularis longus and brevis, for example. And posterior compartment are going to be your flexors. So these are going to be muscles that plantar flex the foot or plantar flex the ankle, flex the toes, and also these do perform some inversion of the foot. Okay, this is gastrocnemius, lateral medial head here coming down, inserting on the calcaneal tuberosity via the calcaneal tendon. Okay, that's a common insertion point along with the soleus muscle, which is deep to the gastrocnemius. Okay, this is lateral malleolus. So your fibularis longus and brevis will be running posterior to the lateral malleolus. This is medial malleolus of the tibia. So your tibialis posterior, flexor digitorum longus, and flexor hallucis longus, as well as your posterior tibial artery and tibial nerve, will all be running posterior to the medial malleolus. This image has the gastrocnemius muscle cut and reflected. So what you're seeing here deep to it is the soleus muscle. So this is soleus. It will again attach on a common insertion point on the calcaneus via the calcaneal tendon. The muscle you're seeing right here, this is the plantaris muscle. Okay, very short muscle belly, crosses lateral to medial, really long and thin tendon. Okay, and this is not present in every individual plantaris. Okay, moving to the superior portion up here, or distal portion of the posterior thigh. This is semitendinosus, semimembranosus, and biceps femoris. Okay, so looking further down at the posterior leg, right here, this has the gastrocnemius and soleus muscle removed. So what you're seeing here, moving down here, this in the popliteal region, we're going to have tibial nerve, and then popliteal artery and popliteal vein. Okay, so then past the popliteal region, we're going to move further into the leg. This is going to be posterior tibial artery and tibial nerve. Okay, so you're going to have posterior tibial artery and tibial nerve. Those will always be running together on the posterior leg. Remember, the fibular artery is going to be coming off of the posterior tibial artery. And these are going to be your flexors. Okay, so what you're seeing here is actually tibialis posterior muscle, flexor digitorum longus, and the flexor hallucis longus. Okay, and those are going to wrap posterior to the medial malleolus here and then go to the sole of the foot. Okay, so in here in the popliteal region, you're going to see tibial nerve, popliteal artery, and popliteal vein. Okay, on the anterior leg, you're going to see, so here's tibia. So just anterior to the tibia is going to be tibialis anterior muscle. Okay, so here's tibialis anterior. Extensor hallucis longus is going to come down and go to the big toe. This is the tendon of it. And then extensor digitorum longus. Okay, go down to digits 2 through 5. So it's going to be on the anterior leg. The anterior tibial artery and deep fibular nerve will be seen in here. Deep and in between the tibialis anterior muscle and extensor hallucis longus muscle. So this has the tibialis anterior muscle removed, and you can see now the interosseous membrane, which would be between the tibia and the fibula. And you can see the entire length of the extensor hallucis longus muscle here and the extensor digitorum longus muscle. Okay, so deep in here is going to be the anterior tibial artery and the deep fibular nerve. Okay, going to the anterior compartment of the leg. This is the lateral compartment of the leg. So what you're seeing here, this is the fibula. So here's lateral malleolus of the fibula. Here's the apex of the fibula. So you're going to have muscles that run along the length of the fibula, and they are the fibularis longus. Okay, as the long tendon. It will be superficial to the fibularis brevis. Okay, so you can see it on either side here of the longus muscle. Okay, fibularis longus is going to come all the way here and go to the sole of the foot and actually attach to the medial side of the foot. Okay, medial and sole of the foot. Okay, all the way over to the first metatarsal and medial cuneiform bone. Fibularis brevis comes down, wraps posterior to the lateral malleolus, and attaches to the base of the fifth metatarsal bone. Okay, and these will be innervated by the superficial fibular nerve, which is a branch off of the common fibular nerve. Okay, so here's common fibular nerve. It will branch into superficial and deep branches. Okay, again, here's fibularis longus. Here's the tendon of it, and fibularis brevis. And this is the distal end of the superficial fibular nerve. Okay, and we'll continue down to the dorsum of the foot. And this is a cadaver image. So this is lateral malleolus here. So you'll have the fibularis longus and fibularis brevis muscles wrapping posterior to the lateral malleolus. Okay, what you're seeing here, this is extensor digitorum longus, and you actually do have fibularis tertius. You can see the tendon of it right here. Okay, so here's fibularis longus with the tendon on top of fibularis brevis, okay, wrapping posterior to the lateral malleolus. Okay, this is a lateral view here. So what you're seeing coming down, this is actually showing you the common fibular nerve, and it branches into the deep fibular nerve, which will run anterior. Okay, you'll see it in between the tibialis anterior muscle and the extensor hallucis longus muscle, which goes to the big toe. Okay, deep fibular nerve will run in this area along with the anterior tibial artery. Once you pass the extensor retinaculum, and this is the superior portion of the extensor retinaculum, inferior portion of the extensor retinaculum, that anterior tibial artery changes names to dorsal pedis artery. Dorsal pedis artery continues around and becomes the arcuate artery. Okay, also seen here, this is the extensor digitorum longus. You can see the tendons of the extensor digitorum longus goes to digits 2 through 5. This is peroneus tertius, or fibularis tertius. Okay, it's been renamed fibularis. This is lateral malleolus, so wrapping posterior to the lateral malleolus will be your fibularis muscles. Fibularis longus comes down, actually inserts all the way on the sole of the foot, way on the medial side, and fibularis brevis comes down, which is deep to the longus, wraps posterior to the lateral malleolus, and inserts on the base of the 5th metatarsal bone. This anterior view of the foot, or dorsum of the foot, you can see the extensor retinaculum. This is extensor retinaculum, and this is the superior extensor retinaculum. So this is superior extensor retinaculum and inferior extensor retinaculum. Okay, inferior extensor retinaculum. This is the distal end of the tibialis anterior. This is the tendon of it. This is the tendon of the extensor hallucis longus muscle, okay, going to the hallux big toe. And this is the tendon of the extensor digitorum longus muscle. Okay, so deep to those will be your brevis muscles of the extensor hallucis and extensor digitorum. So attaching to the hallux will be the extensor hallucis brevis, okay, going oblique. And then see these little muscles here, these little tendons attaching to digits 2 through 5. So these will be extensor digitorum brevis. They come back, and you can actually see the muscle belly of it here. So this is deep to the extensor digitorum longus muscle. Okay, on this view, this is extensor hallucis longus tendon. This is extensor hallucis brevis. These are the tendons of extensor digitorum longus. And then you can see just barely the tendons of the extensor digitorum brevis. This is the distal end of the superficial fibular nerve. You're seeing the inferior portion of the extensor retinaculum. This is the superior portion of it right here, extensor retinaculum. This is the lateral malleolus. So what you're seeing here, this is the fibularis. It's hard to tell if this is the longus or the brevis muscle from this view, but it will wrap posterior to the lateral malleolus right here. This is the tendon of the extensor hallucis longus muscle. This is extensor hallucis brevis, deep to that. These are the tendons of the extensor digitorum longus. Deep to those will be the tendons and muscle of the extensor digitorum brevis, and this is the muscle belly of the extensor digitorum brevis. Okay, this is the dorsum of the foot. Okay, so what you're looking at here, this is the tibialis anterior tendon. This is extensor hallucis longus tendon. And this is extensor digitorum tendon. You can see it's been cut right here. So go to digits 2 through 5. Here's the distal end of those tendons. And then these are your dorsal interosseous muscles right here. So you can see those in between the metatarsal bones. This is also the dorsum of the foot, so you can now follow down the extensor digitorum longus. Okay, comes down, goes to digits 2 through 5. Here's extensor hallucis longus, going to the big toe. And you can actually see deep to these. This would be extensor hallucis brevis. Okay, it's deep to the extensor hallucis longus, and this muscle is short. Okay, and it runs oblique. And then the extensor digitorum brevis, you can see the tendons of it here, and this is the muscle belly of it, extensor digitorum brevis, and that will be deep to the extensor digitorum longus tendons here, okay, and also running oblique. This is the extensor retinaculum. There are two portions of it. There's the superior extensor retinaculum and inferior extensor retinaculum. Looking at the sole of the foot, this is the plantar aponeurosis. Okay, plantar aponeurosis. This image has the plantar aponeurosis scene. So plantar aponeurosis. And this would be the lateral plantar nerve. Okay, and medial plantar nerve. Okay, the medial and lateral plantar arteries will be running right along with these nerves. Medial and lateral plantar nerve comes from the tibial nerve, wraps posterior to the medial malleolus, and goes to the sole of the foot. Medial and lateral plantar arteries come from the posterior tibial artery, okay, which runs right along with it. Okay, removing the plantar aponeurosis, you can see the flexor digitorum brevis muscle. Okay, so flexor digitorum brevis, and you can see it connecting here to the tendons. This will go to digits 2 through 5. On either side of that, you can see the medial plantar artery. So this comes from the posterior tibial artery, okay, which goes passes posterior to the medial malleolus, and then we'll go to the sole of the foot. This will be seen right along with the medial plantar nerve, which comes from the tibial nerve, also going posterior to the medial malleolus. And then going to the lateral side of the sole of the foot will be the lateral plantar artery, also the lateral plantar nerve. Okay, this is the tendon of the flexor hallucis longus muscle. Looking at the sole of the foot, this has the plantar aponeurosis removed. So what you're seeing here on the next layer is the flexor digitorum brevis. Okay, and this is the only instance where the brevis, at least in the foot, is superficial to the longus muscle. Okay, in all the other instances I've shown you, the longus muscle is superficial to the brevis. Okay, but on the sole of the foot, the flexor digitorum brevis, okay, is superficial to the flexor digitorum longus. Okay, attaching here from the calcaneus all the way up to the big toe is the abductor hallucis, and from the calcaneus to the digit 5 is the abductor digiti minimi. Okay, move just medial to that, and this is the flexor digiti minimi. Okay, or flexor digiti minimi brevis, both will be correct. Flexor hallucis brevis, okay, you can see the bellies of that on either side of the tendon of the flexor hallucis longus. And actually seen here, these are lumbricals. Okay, here are lumbricals. This has the plantar aponeurosis removed, so you can see the flexor digitorum brevis muscle, flexor digitorum brevis. Here's lateral plantar nerve and artery, medial plantar nerve and artery, abductor hallucis, abductor digiti minimi, flexor digiti minimi. This is flexor hallucis brevis, flexor hallucis longus. You can see some lumbrical muscles in here. This next layer has the flexor digitorum brevis. removed. So now you can see the distal end of the flexor digitorum longus. So this is the tendon. Remember, this wraps. This goes down the posterior leg and will wrap posterior to the medial malleolus, continues until it attaches to digits 2 through 5. Okay, so this is the tendon of the extensor digitorum longus muscle. It is deep to the flexor digitorum brevis. This will look like it's part of that muscle, but this is a separate muscle. This is the quadratus planta. Okay, or pronounced quadratus plantae. Okay, so quadratus plantae or quadratus planta. Okay, also seen here is the tendon of the flexor hallucis longus. Okay, remember that was also in the posterior leg, wraps posterior to the medial malleolus, will continue to the sole of the foot, to the flexor region of the hallux. Okay, on the other side of that, you can see the flexor hallucis brevis. Here's flexor digiti minimi, abductor digiti minimi. Okay, that's been cut, and abductor hallucis has been cut here. This image has the flexor digitorum brevis reflected. So deep to that, you can see the tendons of the flexor digitorum longus. Okay, and these are lumbricals right here. And down here, this is the quadratus plantae. Okay, quadratus plantae. This is the tendon of the flexor hallucis longus muscle. Abductor hallucis, abductor digiti minimi, and this would be flexor digiti minimi. Okay, again, so this is quadratus planta or quadratus plantae. These are the tendons of the flexor digitorum longus and tendon of the flexor hallucis longus. And this has the flexor digitorum brevis muscle reflected. So deep to that, you can see the tendons of the flexor digitorum longus right here. This is quadratus plantae under here. And coming this way, this is lateral plantar nerve and artery. Okay, coming from posterior tibial artery and tibial nerve, medial plantar nerve and artery. Okay, also coming from posterior tibial artery and tibial nerve. Flexor hallucis longus tendon, flexor hallucis brevis, abductor hallucis, and abductor digiti minimi. Okay, this is even deeper. So this is the adductor. So this is the adductor hallucis. It looks like the number 7. So adductor hallucis. There are two heads. This is the oblique head and the transverse head of the adductor hallucis muscle. This has the flexor hallucis longus tendon removed, so you can see the flexor hallucis brevis right here. This is flexor digiti minimi brevis right here. This is the plantar ligament. And moving deeper, this is actually going to be the deepest layer. Actually, these layers you don't have to remove to see. The abductor hallucis is going to run all the way from the calcaneus to the metatarsal, first metatarsal. So this is abductor hallucis. You also have an abductor digiti minimi, which will run the entire length. And then this is flexor digiti minimi. We have flexor hallucis longus tendon. Deep to that will be the flexor hallucis brevis muscle. And then this is the adductor. Okay, so abductors on the outside, adductor hallucis, and it looks like the number 7. Okay, so adductor hallucis. This is the transverse belly, and this is the oblique belly. Okay, of the adductor hallucis.